Well, hello and welcome back to class. This is Holistic Therapeutics, HT400 for the College of Natural Health Sciences, Bermuda. My name is Dr. Delcina Bean Burrows, and this is Lecture 5B, where we will be discussing foot mapping. Now, this foot mapping is part of the reflexology lectures, series of lectures that we are having. The Lecture 5B objectives are that at the end of this lecture, students will be familiar with the reflex points of the feet, understand the effects of reflexology on the body, understand the effects of obstruction along the energy lines, be familiar with the zones of the feet, be familiar with the guidelines of the feet, be familiar with the osseous anatomy, foot structure, arches, and posture, and be familiar with the various feet conditions and overall indicative health conditions, and be familiar with the reflexology foot maps. Let's take a moment here to appreciate the miracle of the feet. Each part of the body and every bodily function have their own relative reflex point in the foot. This allows an accurate picture of a patient's health to be given by the feet. If an area of the body is suffering from inflammation, tension, or congestion, the corresponding reflex points in the feet will be sensitive when pressure is applied. The feet are miraculous masterpieces of design, exquisitely put together and perfectly coordinating many components. Among the different components of the feet are tissue, 26 bones, 100 ligaments, 20 muscles, and an intricate network of nerves and blood vessels. These marvelous structures reflect comprehensively our state of health. The condition of our feet can give us much information about our physical and mental health. Likewise, how we treat our feet influences not only the performance of the feet themselves, but the functioning of our whole body and mind. It is a two-way street, a reciprocal relationship. So let's discuss a little bit about nerve stimulation. By working on the reflex points of the feet, a reflexologist can stimulate through the nerve pathways an organ function or body part that is tense, congested, or damaged as a result of an accident, injury, or illness. Breaking down the tension helps the system to eliminate toxins when necessary, reduces pain quite dramatically, and encourages the body to heal itself. Reflexology can also reveal past injuries, as many remaining scar tissue will cause sensitivity in the reflexes. The principal goal of a reflexologist is to discover and work out the sensitive spots in the feet by using an alternating pressure of the thumb and sometimes other fingers or on all parts of the foot. The pressure applied to a nerve ending constitutes a stimulus. This is any agent or factor that evokes a functional reaction in tissues, even inducing a physiological change. In reflexology, the stimulus of contact and pressure initiates an electrochemical impulse that changes the nervous processes, transmitting a message through the nerve fibers. Nerve impulses can travel at a rate of about 435 kilometers, which is 270 miles per hour, while electricity travels at the speed of light. You could say that our bodies are basically electrochemical plants that are in motion throughout the day and night. Refinement of the pressure and consistent control is of great importance in achieving a result. People treated by inexperienced or unqualified practitioners often complain that it had no effect whatsoever. They are amazed when subsequent treatment by a properly qualified practitioner produces outstanding and rapid improvement. Reflex points are also found in other body extremities, for example, in the hands and ears. However, the feet sensitivity, because they contain over 7,000 nerve endings, and their size make them the ideal area for the reflexologist to work on. Reflexology teaches that every organ and gland depends for its survival on the ability to contract and relax. Obstructions in the energy lines and fields cause pain to be registered and, in certain conditions, create limitations in motion and functions. For example, a stiff neck or a painful back. Energy blockage also interferes with blood circulation, and this is usually first noticed in the extremities. Hands may become stiff, cold, and often painful. Waste products accumulate at the lowest point of gravity, and the reflexologist can feel them clearly when working on the feet. Reflexology is based on the theory of the zone therapy, which states that there are longitudinal lines of energy, called zones, ascending from the feet to the brain. As we apply pressure to the feet, we stimulate these lines, producing a rejuvenating and healing effect on the entire human body. There are 10 zones in all, 5 on each foot, and they are represented by a simple numbering system, with each zone beginning at the toes. Zone 1 at the big toe, Zone 2 the second toe, Zone 3 the third toe, Zone 4 the fourth toe, and Zone 5 the fifth toe. The fingers link up to the zones in the same way, with the thumb being Zone 1 and the little finger Zone 5. The zones run from the toes to the brain, with the body being divided into 5 zones on either side of the spine. Sensitivity in any one spot of the foot creates an imbalance throughout the entire length of that zone. For example, sensitivity in the right kidney could be the cause of an eye condition because the kidney and the eye are in the same zone. As we work on the feet from one side to the other, we are systematically working through the whole of the human body. Let's discuss the primary zone. Although all the zones encompass parts of the body that can cause us problems, by far the most powerful zone is Zone 1. When working on people's feet, you will find that this zone is always the most sensitive. This is because Zone 1 includes so many vital organs and parts. For instance, we have the crucial central nervous system, spine, and brain, and also the tiny pituitary gland and the hypothalamus. Although only the size of a pea, the pituitary is often referred to as the conductor of the orchestra because it regulates all glandular activity and so has an enormous effect on almost every bodily function, the nose and the mouth. Without these important apertures, we would be unable to breathe or eat. The start of the solar plexus. This nerve complex lies just behind the stomach and is responsible for many moods and sensitivities. In fact, it is an emotional barometer. The reproductive organs, essential for procreation. The navel. This represents the important link between the placenta and the fetus prior to birth. The umbilical cord that connects the mother and child delivers life-saving sustenance to the fetus at the same time as it removes damaging impurities. So let's discuss the guidelines of the feet. In addition to an understanding of zones, the reflexologist also needs to know about the principle of the guidelines of the feet and how they relate to all the parts of the body. Like the zones, the guidelines are fundamental to understanding and the practice of reflexology. The guidelines are quite easily identified in all relating to the diaphragm, the waist, the pelvis, the ligament, and shoulder. The diaphragm line. The diaphragm line is found under the bases of the metatarsals. A distinguished feature of this guideline is that the color of the skin on the metatarsal area is remarkably different from the skin of the underside of the instep. The darker skin is above the diaphragm line and the lighter skin below, so it is almost as if nature had provided an identifying line to help us. The waistline. The waistline is found by running your finger along the outside of the foot until you feel a small bony protrusion about midway. A line drawn across the foot from this point denotes the waistline. It is normally in the narrowest part of the foot. The pelvic line. The pelvic line, sometimes called the heel line, is found by drawing an imaginary line from the ankle bones of either side of the foot and crossing over the base of the heel. The ligament line is the ascending line that runs along the plantar ligament, that taut elastic-like structure that you can feel if you flex your big toe. The shoulder line. The shoulder line is found just below the bases of the toes, and we refer to this as the secondary line. Now let's consider the anatomy of the foot. The arrangement of the bones in the foot allows us to stand steadily and to walk and run while still keeping our balance. To allow our feet their extreme flexibility, there is a complicated structure of ligaments, tendons, and muscles supporting and interacting with these bones. The bones of the feet consist of 7 tarsals, which are the ankle bones, 5 metatarsals, which run the length of your foot, and 14 phalanges, 2 in the big toe and 3 in each of the smaller toes. And here we see illustrated the foot. We have the forefoot, the midfoot, and the hindfoot. Here we also see illustrated the tibia most superiorly, and laterally we see the fibula. Just beneath the tibia we have the talus, and then we also see over to the right the calcaneus. We also see the navicular, the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform, and the cuboid. We also see the metatarsals and the phalanges. Now let's take a look at the arches of the foot. The bones of the foot are arranged in flexible arches supported by ligaments and muscles. These structures support the weight of the body, enable the feet to be flexible, and provide leverage while walking. There are 3 arches in the foot. The medial longitudinal arch, which is found on the inner border of the foot, the lateral longitudinal arch, which is found on the outer border of the foot, and the transverse arch, which runs from side to side. Now let's look at the veins and nerves of the foot. The principal veins in the foot are superficial, lying just under the skin. They are known as the saphenous veins, and the lesser saphenous veins runs along the lateral side of the foot, the outer edge, and behind the ankle joint, then ascends the leg to join the deep popliteal vein around the back of the knee. The greater saphenous vein, which is the longest in the body, begins in the vicinity of the big toe, runs along the medial side of the foot, the inner edge, and then rises up the calf past the knee to the inner thigh and connects to the femoral vein in the groin. The tibial nerve serves the muscles and skin of the sole of the foot, and also the nerves of the toes. It descends the lower leg from the knee, where it is linked to the sciatic nerve, which runs the length of the thigh from the buttock. The sciatic nerve is the thickest nerve in the human body, about the thickness of a little finger, whereas most nerves are as thin as a hair. Let's now take a look at the feet and physical problems. In addition to sensitivities in the reflex area, problems in parts of the body can be manifested in the feet in other ways. Here are a few indicators you can easily observe. As the reflex area of the cervical spine is found on the medial side of the foot, at the edge of the big toe, a protrusion such as a bunion on the toe joint in this area could indicate a neck condition. Someone with flat feet is more likely to be troubled with arches, pains, and stiffness in the lumbar spine. The area under the fifth toe reflects the shoulder area, and hard skin that builds up on the lateral sides of the feet here can reflect tension and pain in the shoulder joint, often called a frozen shoulder. Any deep-seated corns or calluses can interfere with the energy flow and cause inflammation and congestion in the part of the body represented by the reflexes in that area. It is fascinating to see how the feet reflect overall body shape and size. If you are a tall, slim person, you will have long, slim feet with slender toes. If you are a slim with narrow shoulders person, the width of the foot at the diaphragm line will also be narrowed. Your hands, too, resemble the shape of your feet. You will not find a person with long, slim feet, but short, fat hands. So let's talk about reading the feet. Before you begin your reflexology treatment, you want to observe the feet. There is much to learn about the condition of the feet even before treatment has begun. Often, problems with the feet relate to disharmony in the body. Unfortunately, which came first can be more difficult to determine. In consideration of foot posture and bone structure, weight distribution in the foot will depend on general posture. Poor posture can cause pressure on different points of the feet. In some cases, this can be reflected in the organ or system to which it corresponds. Fallen arches indicate the client is walking on the chest points. Flat feet can affect the spine, and highly arched feet are often stiff and less mobile. Now let's consider the shape and size. Look at the shape of the feet. Like the bodies they carry, feet come in all shapes and sizes. Carefully locate the positions and zones of the feet. The condition of the skin. You want to feel the texture of the skin and look at the general skin condition and note the skin temperature. Dry skin may be an indication of neglect or poor circulation. Corns and calluses may be indicative of an imbalance in one of the systems, and it may make certain areas of the skin more sensitive, and as a consequence, corns or calluses can occur. Flaking, peeling skin may be an indication of a fungal infection. Cracked skin may be an indication of dietary deficiency, such as in the vitamin B group, or poor circulation, the wearing of open shoes, such as flip-flops, etc., which encourages the skin to toughen up. Inflammation, what is the cause? Ingrowing toenails or habitual picking of the feet. Scar tissue, has the person had any recent operations, such as for either bunion removal or toe straightening. Fungal infections, you want to look at the digestive points, for candida and urinary system and foot hygiene. Excessively moist and sweaty feet may indicate kidney stress. You also want to check the condition of the nail. Check the nails for ingrowing toenails, usually caused by improper cutting of toenails, any signs of fungal infections, bruising or lifting of the nail plate. You want to also look for puffiness or swelling. Look for puffiness and swelling on the foot. These will be subtle and need to be observed carefully. Around the bladder, it may indicate either a full bladder or bladder retention. Lymph and chest problems may indicate puffiness on the front of the foot. Around the ankles and particularly under the fibular bone and above the cuboid bone may indicate pelvic congestion such as menstruation or menopausal uterine problems. And around the hip point, it may indicate pelvic and postural problems. You also want to look at skin color. Note any discolorations of the skin. Cold bluish, molted or white feet indicate poor circulation. Yellowish tone, possibly elimination problems including the kidneys and the liver. Very pink feet, not necessarily hot, may indicate that the kidneys are stressed from a salty diet or excessive urine production, the presence of medication. Pinky orange tinge to the metatarsal or metacarpal pads may indicate the use of recreational drugs. And then, of course, you want to note the odor. Take note of any of the following. Sweaty feet may indicate a hormonal problem or kidney stress. Cheesy feet, usually associated with poor feet hygiene or foot hygiene. Acetone, which is due to incomplete breakdown of fatty acids linked with diabetes and anorexia, the starvation diets, and rotting flesh. Athlete's foot has a distinctive odor which you will soon learn to detect. You also want to check for edema, which is fluid behind the nails, either the finger or the toenails and around the ankles. You want to check the temperature. Cold feet, common in women, indicate poor peripheral circulation. Coldness only in isolated areas of the feet may indicate a lack of activity and imbalance in the corresponding area of the body. Hot feet, stimulated circulation, which is common in men. If the feet is specific to areas of the foot, this may be mirrored within the body and indicate an imbalance. So now let's discuss the reflex maps. The following maps show the reflex areas for different organs and parts of the body. Each area mapped, for example, the heart, liver, or lungs, contains many reflex points, rather like pins on a pin cushion. To keep things simple, they are referred to as single point. The heart reflex, the liver reflex, and so on. The reflex areas also overlap, so when you work one area, you often contact the reflex point of another area. And here we see illustrated the plantar view of the foot map. You may see some variations in terms of how the reflex points and zones are numbered, but for the most part, there is pretty much widespread uniformity. It may just be some differences in terms of where exactly the overlays are, but for the most part, this is what a plantar view of a foot map looks like. And here we have the dorsal view of a foot map. Here we see the medial and lateral views of the foot maps. And here we have the reflexology hand chart hand map. And this is the ear map. So here are some super tips to keep in mind as you begin your journey as a reflexologist. So for super tip number 1, it is important to communicate with your client. You always want to give them a brief overview of what the treatment involves. Let them know when you are going to start your treatment. And super tip number 2, you want to place a large towel on the end of the bed so that it hangs down at the sides. This should be covered with tissue. You want to fold the towel over the feet so that one side covers one foot and tuck it around the feet. This will keep the feet warm and cozy during treatment. And super tip number 3, in terms of grounding, keep your feet flat on the floor while you are working, and this will not only help your posture, but it will also keep you physically grounded. Okay, so we have reached the end of today's lecture, and for assignment 5B, I'd like for you to, first of all, state what are some of the main benefits of reflexology treatments. List the various foot conditions that you may encounter as a reflexologist. How many reflexology maps can reflexologists use to work on the body? And what are the 3 super tips to incorporate into a reflexology session? And as always, this assignment is due no later than Sunday at 11:55 p.m. If you have any difficulty with this assignment, you may send me an email or a text message. My office hours are always the same, Thursdays from 4 to 6 p.m. And with that, I look forward to receiving your assignments, and I will see you in the next lecture.